So it's been determined that we do have a quorum, and we're going to call this meeting to order. Can I get a motion to adopt the agenda?
I so move.
And I second. All in favor? Aye.
Aye.
Good. Next item is adoption of the minutes. Can I get a motion to adopt the minutes?
And Mr. Chairman, we did make the suggested amendments that Ms. Mood asked for, and that was sent out about 25 minutes ago, highlighted in yellow.
And Mr. Chairman, I'll just say that the reason it was important to me for those amendments to be included is that I wanted the content of what I was saying about how we might work on the initiatives to reach people with the vaccine information. That was the point of my talking about my role. It wasn't to talk about me, but to look at what we might apply and what we're proposing to do. And the only other piece that I want to make clear was that when I talked about how the face mask brackets had made wearing masks more comfortable for me, that was not a directive to the staff to buy those masks or do that, or even to say that I'm recommending strongly that they purchase those mask brackets. I was simply offering my experience of something that had made wearing masks more easier for me, and that's entirely up to the staff to evaluate and decide what to do. I want to be sure I'm staying in my lane here and not giving the impression that that was a dictate.
Okay, well, thank you, Ms. Mood. Thank you for clarification. Can I get a motion to adopt the minutes with the changes and substitutions that we just discussed?
I so move.
And I second. All in favor, aye?
Aye.
All right, next item, Mr. Sanchez and Mr. Deschamps, you have the floor.
Okay, first of all, I'll just go ahead and do the update on the executive order. The governor did extend the executive order January 7th for another 15 days. So that has been extended, and we'll keep you posted if it's extended after these 15 days. What I'll go ahead now and...
May I ask a question on that one, please?
Sure.
My question is really, with the new executive orders from the president, do the things that are in those apply to anyone receiving federal funds, or how do we fit that into our operations? I mean, for example, it really just affirms, but maybe strengthens the mask requirement, and our state executive order does not mandate mask. And so my question is, do we have the support now of a presidential executive order, or does that not apply to us?
Well, I'll just add this, and I know John can add on. In looking at the president's, it was executive order was for, I guess, federal buildings, locations, or anytime you're dealing with federal employees, you're required to wear a mask. I don't, and John, maybe you can talk about whether that would affect our state, but that's how I saw the main point out of the one from the president from the federal standpoint.
And from my read of the president's executive order and just reading some news articles last night about the issue, it's really applicable to those that go on federal property, so post office, federal buildings, VA hospital, anything that's controlled by the federal government, or if you interact with a federal employee or an on-site federal contractor. So like Fort Jackson is another one, for instance, or if you interact with FTA representatives or FHWA representatives, you have to wear a mask. But it does
but
not
not to
apply.
all recipients of federal funds.
It does not apply to all recipients of federal funds. That is correct.
Okay, thank you. As I said, that really is just affirming what we've taken as our policy, so it's not wouldn't be a new requirement for us anyway.
Correct. Okay. And at this time, I'll let Joe Sanchez come on and do the updates on the operations.
Hi, good morning. Good
Good
morning,
morning, Jeff.
Ms. Moon and members of the board. We had a couple of personnel that tested positive for the COVID strain, and obviously we had the building deep cleaned and fogged. The vehicles that these operators operated deep cleaned and fogged as well. Both of them, well, one of them has returned back as she tested negative for her test. So we have that, and she's back at work. We have one that's still out. He's waiting to take his test. And I'm looking forward to a negative test result on that, as well as he was self-isolating and in good spirits. He sounded very healthy. We had a precautionary scare with a maintenance technician that wasn't feeling well. He scanned his temperature at the thermal scanner in maintenance, and his temperature was about 98.8. But after sending him home and asking him to go take a test to make sure that it wasn't COVID related, we had the building deep cleaned and fogged as a precautionary measure, and anywhere the technician might have touched. He took his test and his test came back negative, so that's good news there. Overall, from the 1st to the 21st of January, we've done 31 food service deliveries. Again, that number is creeping up slowly. We've done 246 details on the vehicles, and again, that's from the 1st to the 21st. We've done 228 foggings, and we've done 698 interior and exterior cleanings on the fleet. That's what I have on the vehicles and the COVID, and what has transpired in the past weeks prior to our discussion earlier. Just wanted to give you a full picture. Obviously, the detailing numbers, the foggings and the interior exteriors, those are all prelim numbers. Once everything is finalized and entered into the Solutions for Transit program, it'll be a more finalized number that I'll be able to give you at our next meeting.
Thank you, Mr. Sanchez.
Yes. Go ahead.
Any questions for Mr. Sanchez?
No, thank
Please
you.
proceed.
Okay, this is Mr. DeChamps again. Just a couple of updates on testing. The next testing for staff here at the administrative building will be February 2nd, Tuesday, 8 to 10:30 a.m. and on February 3rd, that Wednesday, from 1 to 3 p.m. Also, the COMET continues to do the COVID-19 testing in coordination with DHEC at COMET Central with the secured kiosk, and that's still continuing Wednesday through Friday, 7 a.m. to noon, and then 2 p.m. to 6 p.m., and then on Saturdays from 10 a.m. to 5 p.m. And also, in your packet, it shows some of the results from these particular days in the last week or so. And we have one other testing here at the building with Lovelace is in March, and then we will see where we are as far as scheduling further out for any COVID testing. And next up, we would have the update on the driver's barriers, if there's no other questions on testing.
No.
Joe or Maurice, can you provide that update on where we stand with driver barriers and the FAR UV technology, or if Ronnie's on the line?
Ronnie's on the line. He can share the detailed update.
Good morning, everyone. I'm
Morning.
very happy to report that we're having 2 drivers barriers installed into 2 small vans, 15301, 15302, as we speak. With those being completed and the 5 nabbies being completed last week, the only thing remaining is the 31 new flyers, and the New Flyer Corporation is manufacturing the driver's barriers for those currently, and they are expecting them to ship to us by mid-February with their installation team to come and install them soon after delivery. So we're looking at the mid part of February. And then the only other 2 is the trolleys, and the New Flyer engineering people are looking at how to design that. And I sent them an email today and asked for an update on that, but I hadn't got that yet. But bottom line is the 31 New Flyers mid-February, and the 2 trolleys probably mid to late February, and that will be all, that will complete them for us.
That's very good news.
And Ronnie, do you have any update on that FAR UV technology? Did they come out to install that on, I believe, bus 801?
They'll be here tomorrow at 11 a.m.
Okay. And I presume they'll give your staff training on how to use the system, and perhaps you could report back at the next COVID meeting on how it's working out?
There's nothing in the email about that, but I'm sure they will. That's usually the protocol that people do when they install it.
Okay. Thank you, Ronnie.
Uh-huh.
Okay, this is Tanisha. I have the update on the DART office space. We're still social distancing inside the office, and we do appreciate the recommendation of the face mask bracket. We did evaluate them, and they are using them. They like them. It's easier to talk, it's easier to breathe, and they're still able to talk on the phone with them. So that's the update that I have on the DART office space.
All right, hearing no further comments, I'll take on update of the vaccination and impacts to public transit. First and foremost, phase 1B appears to have now been pushed to early spring 2021 versus late winter 2021. So it's anticipated that phase 1B for public transit workers is now going to be in the March-April timeframe. We have drafted a letter from the comment employee, from myself as well as the interim general manager of RATP Dev that we is being reviewed, and then once finalized, we'll send out to all employees of the comment and RATP Dev, advising them about the vaccine, and that once phase 1B comes into play, that will give additional instructions on how they can get the vaccine if they so desired. While it's not a requirement, it is being pushed in our letter that is strongly recommended and encouraged to have people get the vaccine. We are working with DHEC to set up a registration table at Comment Central to allow seniors to register the vaccine if they're not able to register online. It appears that we now have the Pfizer and the Moderna vaccine here in South Carolina. And the pharmacies are now starting to get involved with the vaccination process. for the Phase 1A participants. And back in January 15th, Phase 1A was expanded to include seniors ages 70 years and older. And in order to get the vaccine, you have to register online at a special website. Staff is also working on the implementation of Take the Comet to Vaccination. And this is a program that's going to have 4 components to it. The first component is we're going to promote the Comet fixed route system as it stands. And we're going to have a brochure that will list all the CVS, Walgreens, hospitals, and urgent care facilities where the vaccination can be taken place. It will also show which bus routes go by which of those locations. We'll distribute that on the buses and online to encourage people to use the Comet system as it stands. If you look on page 15 of your packet, we use GIS to plot all of the Comet routes in operation today, as well as the DART service area and all of the pharmacies, drugstores, and hospitals and urgent care facilities that are in our service area. And you'll see that there are a lot of these locations along existing the Comet routes. So I think the promotion of our fixed route service will help make access easy for folks to get the vaccination. We're also going to implement DART same-day service for seniors 70 years and older and eligible DART riders. Same-day service will be available as long as the person has made a reservation to receive the vaccination, and that the reservations can be made up to 7 days in advance. We're currently awaiting additional guidance from our ATP Dev to make sure that we have available vehicles to perform this service, because we anticipate that by adding this additional demographic group to the DART service, it could potentially create capacity constraints, which we're not allowed to have for the ADA community, so we need to make sure we have ample vehicles. I'm estimating, based on people that are utilizing demand response service in other areas, that we perhaps may need at the minimum 2 additional vehicles added to the DART program on weekdays. We're also promoting the pickup program for seniors and persons with disabilities. That program started on January 19th, where we provide a $50 card for a senior or persons with disabilities to utilize on taxi, Lyft, or Uber. And this is a program that, in essence, a person who wants to get the vaccination could utilize if they don't want to use DART or the regular Comet system. And then the last program is the Vtrip Volunteer Transportation Program, also for seniors and persons with disabilities, by merely finding a friend to have them transport them to where they need to go, such as to the vaccination facility, and we'll reimburse that user at 56 cents per mile. That's the new IRS rate as of January 1, 2021, up to 100 miles per month. Our marketing team is currently putting together the marketing plan. Within the next week or so, you'll start to see a marketing blitz in newspapers, social media. We're going to start engaging with various churches, social service agencies, and community groups. And we're also using the assistance of prominent African-American leaders to ensure that the message is getting out about the importance of getting vaccinated and utilizing the Comet to assist with that. We're also in communications with DHEC on how they can help push our message to those in Richland and Lexington County. We are also continuing to engage with Uber and Lyft as it relates to partnering with their vaccine access campaign programs, which will also provide another measure for the general population to get access to the vaccination. FTA did put up some recent guidance that the use of FTA funds is allowable for transporting passengers to vaccination sites via the 5311 program in our rural areas. So that would be the Lower Richland area and Batesburg-Leesville, or in our urban area via our 5307 program, or via the 5310 program, which pays for Vtrip and the pickup program, which comes through the Council of Governments. Unfortunately, the Columbia urbanized area did not get the Coronavirus Response and Relief Supplemental Appropriation Act funding that was recently passed by Congress. And that is because based on the way that the formula was derived, we did not qualify, as the same case with other urbanized areas in South Carolina. But they did give us, to the Columbia urbanized area, $84,000 of the Coronavirus Response and Relief Supplemental Appropriations Act funding, which we're in discussions with the Council of Governments on how we can access that funding to help supplant this vaccination transportation program that we're doing. We will utilize 5307, 5311, and our CARES Act funding to cover the cost of the enhanced transportation service that DART would be providing at 100% federal share based on a rate of $44.63 per revenue vehicle service hour. At the present time, there's not a need to add additional buses to the common system, but if there are, we'll keep this committee apprised and seek direction on doing so. If there's, after our marketing efforts are promoted, that we see an increase in ridership that can create capacity issues on the common fixed route service. With that, that concludes our presentation. I'd be happy to answer any questions on this matter or any other items that we discussed this morning.
Any questions for staff from the committee?
Yes, Mr. Huggins, I want to just be clear on the comment about whether we will need additional DART vehicles to implement. Are we talking about potentially needing to purchase new buses? Or
No,
are we talking about getting vehicles into use that we have available?
No, we have plenty of DART vehicles. It's merely adding more drivers to our peak requirements so that we do not create a situation where we're denying ADA trips.
Got you. So could Mr. Sanchez, or you mentioned Mr. Bell's name, I don't know if he's on the call or not, but to just let us know how they see where they are with that, because I know getting additional drivers sometimes is not easy. So could one of them speak to that?
Yes, ma'am. We are in the process of working with our subcontractor, TCS, and we also have some training classes currently ongoing right now in order to be able to provide the staffing necessary.
Okay, so that doesn't look that looks doable to you?
Yes, it does. Yes, it does. It's
great. That's good news.
It's all for the right reasons, and so we're going to do everything in our power to make sure it happens.
Any other questions? Any other questions from the committee? Mr. Burgess, have any questions? Thank you all.
One other thing I would ask, Mr. Chairman, is I think this is both the service that we're offering and the marketing plan are extraordinarily good response to what we were asking for and hoping for. And what I'd like to do is if there's a way to give us a capsule description that's for public consumption, if you send that to us, I'll get that out to all of the groups that I'm associated with that have older citizens related to them, churches, community groups. Just individually share that information. And so is that something that we're ready for to do?
We should be ready to do that starting next week.
Okay.
So once those
as soon as you get it to me,
are ready, we can send that to you.
We'll put it out, because I know a lot of that kind of informal person-to-person sharing that happened when the 1A was expanded to the 70-plus age group resulted in an enormous demand for vaccine and a huge response. And so I'm encouraged by what's already happened to think that if we use some of those same just informal networks, that will add to what we're doing in our formal marketing plan.
Agreed, and that's one of our marketing efforts that we're utilizing is using prominent leaders to help us in passing the word on, because while traditional media marketing will help, we're not sure that it's going to be 100% effective. So we're going to have to rely on word of mouth, and we're going to have presentations with the various neighborhood associations in Richland and Richland County and City of Columbia, for instance, churches. So yes, any assistance you can provide, and that would be appreciative.
Well, and this really feeds right into the whole philosophy that we talked about in this initiative, and that is when we hear something from a friend that we know personally, that carries a different kind of weight than when we hear it on a formal announcement or from a stranger. So we just want to make the most of that network of friends and acquaintances to get this going.
Well noted, well noted. Any other questions from the committee? Okay, I would like to tell staff and Mr. Ando, your staff, and Mr. Bell, your staff, how much I appreciate all the hard work. I know you're putting a lot of time into this, but I know this is very important for our passengers, our drivers, and our community. So I commend you, and I do appreciate all the hard work. Can I get a motion to adjourn?
I so move.
I second. All in favor, aye?
Aye.
Aye. Have a great day.
Thank you.
Thank you. Thank you.